Thank you very much, Professor. I'm happy to be here with you and to have the opportunity to exchange and to connect with researchers from Africa and elsewhere on this highly interesting research on the food environment. And I thank also Professor Amos and the MIL for CD teams for involving me in this important event.
Okay,
Therefore,
Adama, could I just ask you to share your slides in full screen, please?
in
In
full screen.
yes, in yes, that's
Okay.
great. Thank
Okay.
you. Yes, thank you.
Okay.
Yeah.
So thank you very well, Professor Amos and the MIL 4CD teams for involving me in this event. And I have the pleasure to present you the evaluation of public policy for the creation of healthy food and environment in Senegal, the results and perspective. This research project was funded by IRDC and is implemented with the collaboration of University of Montreal in 4 months and Science and Belgium, FAO and UCAT. So the research collaborator for this project is, Jean-Claude Moubarak, Julien Soliba-Manga, Stéphanie Van de Berge, and Komlan Kwadjode from FAO. Thanks to all the team. In the context of these studies is derived by the fact that, as observed, developing region food system has transformed rapidly in the past several decades. And the main cause were intensive agriculture, industrialization, population growth, urbanization, climate change, and technology innovation. And as consequence, we have the nutritional transition marked typically by a shift from widespread of many food and nutrient into a surplus of processed and ultra-processed food. And these are raising the triple burden of malnutrition and non-communicable disease like obesity, hypertension, diabetes, and cardiovascular disease. Even those international community recognize this issue, there are insufficient commitment and action from the government to improve the food and environment. Therefore, the challenge, particularly in West Africa, were to address these aspects and to generate scientific evidence to better understand food policy and system and their impacts on food environment. In Senegal particularly, there is a lack of evidence on the level of implementation of public policy, for food policy, compared to international best practice. In 2017, the Senegal have started the development of food-based dietary guidelines. And we take the opportunity to initiate a research project and aiming to use the FOOD-EPI models, the first time in French-speaking West African country, and to use this tool in order to evaluate our policy, public policy. And these research projects, the objective of this research project was to assess and identify and prioritize public food policy in Senegal using the FOOD-EPI model, but also to implement a local platform of researchers and key stakeholders to develop a large-scale research action project on food policy in Senegal, and also to promote the creation of a research network to expand the Senegalese experience and strengthen policy and the promotion of healthy food environment in West Africa. As I say, we use the EpiFood tool to do this evaluation. And as you see in this slide, the tool includes a policy component with 7 areas on specific aspects of food environment, and an infrastructure support component with 6 areas to strengthen system for the prevention of obesity and NCDs. In total, as you see, in total, in this tool, you have 47 indicators of good plastics, and in Senegal, only 43 indicators was assessed through this evaluation. The process of this evaluation in Senegal was led by a panel of independent and government experts on food and nutrition and public health. And the process, the EPI-food process has been implemented through 4 main steps. The first step consists in the presentation of the tool to the multi-sectorial committee, and also to elaborate the reference document, to collect relevant policy document and analyze the context, to elaborate the public policy evidence report, and to validate the report with the stakeholder. The second step of the evaluation with the selection of the experts, the government and independent experts. And after that, 2 workshops has been organized to assess the level of policy implementation by these experts, to identify the major gap and action to address this gap, and to prioritize the action to be recommended to the government to address this gap. And the last step was to translate and disseminate results and to promote the creation of the research network. The evaluation of these, public policy in Senegal was performed by 31 experts, 15 in the group A and 16 in the group B. And these experts have evaluated 43 relevant indicators out of the 47 defined by the FOOD-EPI model. In total, 21 indicators was assessed in the policy component and 22 indicators in the 6th domain of the infrastructure support component. And the score was used to evaluate the policy, the public policy. For the identification, action was identified to address the gaps observed in the implementation of the policy, and thanks policy action already implemented. Additional select actions that could address the double burden of the malnutrition was also identified. And the prioritization of the action to be recommended to the government was evaluated by the importance of the action, the capacity of the achievement of this action, and the potential effect of the action on the double burden of the malnutrition. In terms of results, we have the evaluation of the public policy of in Senegal using the EPI-food module shows that overall 72% of the indicator evaluated, meaning 31 out of the 33 validated, was rated as low. And if you see also, according to the type of evaluator, government actor attribute a high percentage of implementation for several indicators compared to independent actor. Indeed, government actor rated the implementation of 4 out of the 43 indicators as average, compared to 1 out of 43 indicators in the independent groups. When we mix all the group, we see that only one indicator, meaning that the strong and visible support for pulse self as rated as medium. All 72% of the indicators was rated as low. After the evaluation, 33 priority action as recommended to the as it was identified in the policy component, and 14 priority action in the infrastructure support component. And when we use the 3 criteria, mainly 10 actions were identified to be recommended to the government of Senegal to address the issue of food environment. So in this slide, you see that in each of the component, policy and infrastructure support, we have 5 priority actions. For the policy component, the stakeholder identified 5 priority actions, like define a model of good practice and nutritional standards that address the content of nutrient of concern in food offered in restaurant, fast food, outlier, to develop a school local food-based menu, to establish a nutritional standard for school meal, to introduce mandatory legislation for nutrients like energy, saturated fat, total fat, protein, carbonate, sugar, and fat on labeling, and to promote healthy eating during peak view times through the media. And in the infrastructure support, the government, the stakeholder, the expert evaluator, recommend to measure the extent of promotion of unhealthy food to children, to conduct a national food consumption survey, to finalize the development of national food-based dietary guidelines, to include the 6 to 9-year-old to the nutritional surveillance and monitoring, and to strengthen the monitoring framework of the national strategic plan for NCD control. And the result of this evaluation shows that 22 indicators appear to be related to healthy eating or promotion of healthy diet and can guide the development of food-based dietary guidelines. And then mainly this indicator is in the area of food composition, labeling, promotion, supply, retail, and price. The 5 priority actions recommended by the stakeholder to the government can facilitate the operationalization.
Adama, sorry to interrupt you. You've just passed your time now by 2 minutes. So
okay.
Could we perhaps leave some of this for the questions afterwards?
I just finished
okay.
Okay. So so I just want to add something like the opportunity we get from this research project. We have implemented the REPSAO, the network, the Food Policy and System Research Network in West Africa. And 2 research projects was initiated. The first one is understanding change food system to reduce the triple burden of malnutrition in Senegal. And the second one is the evaluation of policy and development of multi-sectoral strategy to promote healthy and sustainable food environment in Francophone West Africa. This project will be implemented in 5 countries in French-speaking West Africa. Thank you very much for your attention.